Our kidneys are vital organs with important jobs. They clean our blood, separate waste, and remove extra fluid, but problems can arise.
Hi, I'm Dr. Lenora Coleman, President and founder of Healing Our Village. Welcome to For Your Health. This is a program that we do weekly, and we talk about hot topics, chronic diseases that are severely affecting minority communities, especially the African American community. This month is the month of March, which is Kidney Month. And so this month we're going to be talking about chronic kidney disease. And so we've had several of our physician experts from around the country to be able to come on and share their knowledge with us as it relates to chronic kidney disease. And today we are honored and so happy to have Dr. Wofford from Memphis, Tennessee. And he is going to be here to talk to us about chronic kidney disease. He's a medical director of his own clinic, and he's also a nephrologist. So he will be able to tell you everything we need to know about chronic kidney disease and much, much more. So Dr. Wofford, I want to thank you so much for tuning in and coming in today to help our audience understand about chronic kidney disease.
Thank you, Dr. Coleman, for this opportunity.
Yes. So, listen, I want the audience to know a little bit about you. So, tell us a little bit about who you are and where you are and how you sort of got into what you're doing right now with nephrology.
Thank you for the opportunity again. I'm a native of a small town called Woodland, Mississippi, small town in northeast Mississippi, about 40 miles southwest of Tupelo, Mississippi. I went to school there and graduated in 1992 and went to Mississippi State and got a BS in microbiology in 1996.
Okay.
And I went to the University of Mississippi Medical Center and graduated 2000 with my medical degree. And I did my internship and residency at Methodist Labonner Healthcare in Memphis, Tennessee. Then in 2003, 2004, I was chief resident of the University of Tennessee Health Science Center in Memphis.
Okay.
The UT and the program I went to a community-based internal medicine program, merged, and I was one of the four chief residents, 2003, 2004. In 2005, I returned to Mississippi and did a fellowship in nephrology.
Mm-hmm.
Then I started nephrology in Memphis, January 1st, 2007.
Wow, you remember the actual date?
Yep.
Yeah.
And then I've been solo practice since 2009.
Okay. All right. Well, I am so really glad you're in solo practice because many of our doctors, as you know, have been all sort of, sucked into various healthcare systems and those kinds of delivery systems. And sometimes it makes it a little bit harder for our patients to access those healthcare systems. So I really want to keep our solo practitioners out there, working with patients and having the availability of their clinics and their private practice offices. So we're going to talk today about chronic kidney disease. And so if you were to describe to our audience what chronic kidney disease is, what would you say?
Chronic kidney disease is a disease that affects the kidney. It can be, usually by the loss of kidney function. Chronic kidney disease usually means that your kidneys have not been functioning normally for over 90 days to call it a chronic disease. Otherwise, it would be called acute kidney injury. It'd be what you call. And the chronic kidney disease means the kidneys, one of the main functions is filtering the blood and removing toxins. And also remove extra fluid. So when you have chronic kidney disease, the kidney doesn't function normally. So all those function of the kidney, it doesn't do well at all.
Right. So you get the accumulation of the fluid, you get the accumulation of the toxins that can actually make you sick and cause lots of other problems. So the reason why I wanted to talk about this is that I know that African Americans, tend to have higher rates of chronic kidney disease. Why is that?
I think it'd take a long time to figure that question out and give you a complete answer. A lot of times it's socioeconomics. Sometimes it's genetics, a lot of environmental factors. But we know African Americans can be 2 or 3 times higher than our Caucasian colleagues in the amount of chronic kidney disease that leads to kidney failure and requiring dialysis.
Yeah. So the
And also,
statist. Yeah, go ahead. I'm sorry.
oh, go ahead. I'm sorry.
No, so I was going to say that the statistics shows that even though African Americans are only about 13% of the population, they represent 35% of the folks that have chronic kidney disease. And I tell my patients all the time that when you go into any of the dialysis centers, right, DaVita or Fresenius, any of those centers that are around the country, and look who's in there, there's going to be a large number of African Americans, mainly because they also tend to have diabetes and high blood pressure, both of which affect the kidney, right? So that's another reason why we see so much kidney disease in African Americans.
Yeah, I can really attest to that. Being in Memphis, Tennessee, there's a large African American population, and 99%, 95, most probably 95 to 98% of my patients are African Americans. Um, so I really see when I go into dialysis centers, unfortunately, there's a lot of African American patients who are suffering from this terrible disease.
Right. So I actually have spent the last 40 years. I was kind of smiling a little bit when you were talking about when you went to school and got your medical degree and then went back and got your fellowship. I started doing this in 1979. So I've been at this a long time, and I'm actually speaking for Xavier University next month. They have a Health Disparities Institute, and so I'm going to be talking to them about health disparities and health equity at their annual conference. And we were having the planning meeting, and I told them on the call that things are getting worse and not better. When I got out of school in 1979, actually, diabetes was only about 5% of the U.S. population. It's now at over 30 million people, right? So 5 million people back then, 30 million people now. And it's just crazy. So the amount of diabetes has really increased, and the number of diabetes complications, nerve disease, eye disease, kidney disease, heart attack, strokes, all of those are off the chart, especially in African Americans, because nobody's getting their blood pressure to 130/80, and nobody's getting their hemoglobin A1Cs to less than 8%. 7% is what we're trying to get to. And so because we're doing such a bad job at controlling high blood pressure and diabetes, this is why things continue to, why you have 98% of your patients in there are African Americans in your dialysis centers, yeah?
Yes, diabetes, Memphis, Tennessee is unfortunately, we're in the stroke belt. And I
Yeah.
often tell cardiologists, endocrinologists, it's also the diabetes belt, peripheral vascular disease belt, heart attack belt, and chronic kidney disease belt, because the same diseases, diabetes, hypertension, obesity, smoking, inactivity, diets, all lead to the same disease. If you're high risk for stroke, you're also high risk for having coronary artery disease, and high risk for having peripheral vascular disease, and high risk for having end-stage kidney disease or end-stage renal disease.
Yeah.
So all these same diseases lead to multiple other diseases. So diabetes is also, as you know, is number one
Right.
in the cause of why people are on dialysis. Hypertension is number two. So if you have
Exactly.
hypertension and diabetes and obesity and smoke, you're really that's just a deadly combination for chronic kidney disease leading to dialysis.
Exactly. And so you just ticked off some of these risk factors. So you said diabetes, hypertension, but also cardiovascular disease, right? High cholesterol values, coronary artery disease, but also smoking. And I would bet you that a lot of your patients are overweight in
Yes,
Memphis,
obesity.
tendencies. So obesity is there, family history, and then just as we get older, right, our kidney function starts to go down slightly just because of aging. If they didn't have anything
Yes.
else, right?
Even aging is, you're exactly right. Going back to obesity itself increases your risk of having chronic kidney disease if you didn't have hypertension or diabetes. But we know that's not in isolation. A lot of these other diseases are all in combination in the same person.
Exactly.
So that's why we also preach all the time about diet, exercise, weight loss, smoking cessation, controlling as best we can your diabetes to goal and hypertension to the goal.
Yeah, yeah, it's so important. So when someone comes into your clinic, how do you diagnose their kidneys? What are the diagnostic tests that you use?
Well, usually pretty simple. And I usually most time they see me and they're already have a diagnosis. Usually, most primary care physicians or nurse practitioners, other providers, they don't send every patient with chronic kidney disease, so they're aware of chronic kidney disease. And what really helped is that the lab have an estimated GFR, so somebody can look and get their annual labs or quarterly labs, they can say the creatinine and the normal creatinine vary from tested, lab to lab, but usually 0.6 to 1.3 or 1.4. And then it also has the estimated GFR. So the provider or primary care physician can look at it and say, this is this patient's GFR. And usually we recommend, usually stage 4 chronic kidney disease, they should be seeing a nephrologist. Sometimes stage 3, when usually most of the complications start to begin in stage 3.
Right,
But at
right,
least by
right.
stage 4, they should be seeing or referred to a nephrologist. Don't know what's causing that chronic kidney disease. That's another indication and reason why to send them to a nephrologist earlier.
Right, right, right. So the audience knows that GFR stands for glomerular filtration rate, right? That's what GFR is. So that's how well your kidneys actually are filtering the toxins and the waste and that clearing out the excess water that we talked about at the beginning. So if and you just mentioned stage 4, so there are actually 4 stages, right, of kidney disease,
Well,
and
it's actually 5 stages.
5 stages. Okay.
Chronic kidney disease, as we said earlier, that your kidneys are not functioning and filtering the blood normally for over 3 months or 90 days. That's
Right.
chronic. It's
Okay.
5 stages. Stage 1, when you have this chronic disease that's been going on, but your kidneys are working normally. They're filtering over 90 drops of blood per minute.
Yeah.
Stage 2 is mild, 60 to 89 drops of blood per minute. Stage 3 is moderate, when it filters between 30 to 59 drops of blood per minute, milliliters per minute. Stage 4 is severe, 15 to 29 milliliters per minute. And stage 5 is the failure stage, when your kidneys are filtering less than 15 milliliters of blood per minute. I use an analogy of a car. When your car is over 90 miles an hour, it's normal. But when your car gets less than 15 miles an hour, that car is failed. It's poor. So that I try to use something simple that patient can relate to about their chronic kidney disease. So people know when your car is less than 15 miles an hour, not any good. But
No,
when
you
your
can,
kidneys
certainly
get to
can't get
that
on the
point,
freeway,
when
right?
kidneys are working at that level, we got to make preparations in the future.
Yes, yes, yes,
You're
yes.
exactly right.
That's right. That's right. So listen, we're going to take a short break right now, and we're going to come right back because I want to continue to talk about chronic kidney disease and the diagnostic tests that we use. So give us a minute out there in the audience. Stand up, walk in place, go out, get yourself a glass of water. Come on back because we're talking about for your health, chronic kidney disease.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol and organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.
Hi, this is Dr. Lenora Coleman. Welcome back to For Your Health. As you know, March is Kidney Month, and so today we're going to be talking about chronic kidney disease. And we're so lucky to have our guest today is Dr. Wofford from Memphis, Tennessee, where he is a nephrologist, has medical director actually of his own clinic in Memphis. And we were talking about the diagnostic tests on how you detect if a person has chronic kidney disease. And so we've already covered creatinine, and we covered the EGFR, which is glomerular filtration rate. Now we're going to talk a little bit about the albumin-creatinine ratio. So Dr. Wofford, tell us a little bit about that test. And I know that test is already done usually before you're actually referred the patient by the primary care. Yeah.
Yes, ma'am. It's a urine and the creatinine and the urine, and they come up to a ratio. A ratio of albumin to less than 30 is normal. A ratio of 30 to 300 albumin urea, and above 305 macroalbuminuria. On the standard dip tip, 10 to 20 milligrams per deciliter is the minimum that used to detect the albumin in the urinalysis.
Okay, all right, yeah. So that's a very important. So when I talk to my people with diabetes, they need to be asking their doctor what their glomerular filtration rate is, and we said it needed to be greater than 60. We would like them not to be less than 60 if we could. And then we would also want them not to have any protein or albumin in their urine, because then that detects that you're starting to get some damage to your kidneys. And so that 30 to 300 is the number that you just mentioned.
Yes, ma'am. Sometimes I see patients greater than 300, and that's when you use the protein creatinine ratio to give an estimate. It could be a 1,000 milligrams of protein or higher.
Wow.
And all that has a lot of significance in a patient with chronic kidney disease. And give a good analogy of patients who have a car. I go back to the car analogy. Hey, you're leaking protein, so like a car leaking oil.
Right.
You don't want a car to leak a lot of oil. The car leaks a lot of oil, that's bad. So you don't want your kidneys to leak a lot of protein.
Right.
So that's why we try to do measures to try to reduce that amount of protein if your kidneys are leaking that amount.
Exactly. Now let's talk a little bit about the signs and symptoms. What kind of symptoms do patients come to you with, which kind of leads you to the idea that maybe they have some problems with their kidney?
Usually, like we said earlier, we talk about the stage of the chronic kidney disease. I usually see patients stage 3, stage 4, or stage 5 of chronic kidney disease. So some patients have little symptoms or no symptoms. Some patients more severe stage of chronic kidney disease can have nausea, vomiting, fatigue, weakness, sleeping problems, concentrating. And also, as you get higher stages again, itching, shortness of breath, fluid build up in their body.
Yeah. Yeah. All of those are symptoms. So now those symptoms, there other things could cause those symptoms. So a lot of times patients sort of just say, oh, well, it's just probably my diabetes acting up, or it's just my blood pressure acting up. And they don't realize that it's actually their kidneys that are starting to fade. And that, I guess, probably the edema or swelling probably brings a lot of people to their doctor because they notice that, right?
Yes, ma'am. That's something that can really tangible and can be seen. And when they can't have problem putting on shoes,
Right.
that means that usually that's something they can notice and they'll let you know right away. It's something that like that. Some nausea they may say, oh, it could be my reflux or it could be something else. But
Right.
something like you said, very tangible. My pants don't fit the same.
Right.
My shoes don't fit the same. Then obviously when they come see me, I can examine them and diagnose it right away. But you're exactly right.
Right. Right. Women will say they can't get their rings on. So right, so they're all of a sudden their fingers are a little swollen, and so they can't get their rings on. So that'll bring them to the doctor to try to figure out what's going on. One of the things that we struggle with in the area of diabetes is that most of our doctors, I wouldn't say most, but there's still a number of physicians that aren't doing checking for albumin in our people with diabetes, not checking for renal function in our people with diabetes. And so I want you out there in the audience, you need to ask your doctor when you go to see them, so how are my kidneys doing? How is my heart doing? You need to make sure that you're getting all of those tests. You're supposed to, once a year, you're supposed to be going to see the eye doctor. So we need you patients out there to help the doctors do a really good job at taking care of your chronic conditions so that we can prevent kidney disease, because the next topic of discussion is dialysis. And that's what happens when your kidneys actually fail. Talk to us a little bit about what dialysis is and the types of dialysis that patients actually participate in.
Unfortunately, dialysis is a result of kidneys moving into the stage 5 for patients with chronic kidney disease. That means they're at the failure stage, and we talked about earlier, they filter less than 15 milliliters of blood per minute. So your GFR is usually less than 15 and sometimes lower. Dialysis is a procedure to take the blood out of your body or fluid out of your body and run it through a machine. And the machine can, hemodialysis machine will remove the blood out of your body, and the machine has an artificial kidney that can remove the waste and the fluid, the excess fluid that your kidneys cannot do on their own. The peritoneal dialysis is a procedure that your own body cleans itself, removes the toxins. It requires a catheter, a long tube placed in your abdomen, and your own body cells can clean the blood and remove the toxins. That's peritoneal dialysis. But dialysis itself is a procedure to take the waste and the fluids out of the body, the excess fluid, and remove the waste from the body, simply put.
Yep. And the thing about dialysis is once patients are on dialysis, that it really basically decreases their lifespan. Once you get to the point that you have to do a dialysis, how many times a week do you suggest that they do it?
Dialysis usually a typical person on dialysis is at least 70 kilograms. And 70-kilogram person runs usually 4 hours per treatment, and the treatment is usually 3 times per week.
3 times per week. Yeah. So they're in there for how many hours?
4 hours.
4 hours. Yeah. So this is a significant part of your life, right? So that means you're going if you're not doing at home dialysis, right? If you're going to a dialysis center, you're getting in your car, driving someplace and didn't put on a machine for 4 hours, 3 times a week. And so we don't want you to be spending those 4 hours 3 times a week, right? We want you to be having some fun in those 4 hours 3 times a week, right?
You're exactly right, because also that's why it's important to, like Dr. Coleman said earlier, know and be in educate about your own health. That way, what I usually do, if they're in stage 5, 900, they already been referred for transplant evaluation if they so desire.
Right.
So we try to look at it before you even get to, and know your way. We cannot stop it a lot of times, but we can try to do things to try to at least get you a kidney transplant, so you may never need dialysis, so you don't have to worry about going to dialysis 3 times a week for 4 hours.
Yeah. Let's talk a little bit about that since you brought it up. I think that how hard is it to get a kidney? I know you have to match, right? And you have to find a donor who has a kidney that actually matches, your blood type, etc. Talk to us a little bit about kidney transplants.
It's a long process because
Yeah.
first you had to be cleared. I
Right.
mean, the patient on dialysis, they'll go through a battery of tests. Make sure you don't have active, severe, uncontrolled psychiatric disease. You don't have active infections, whether it's HIV infection, whether it's pneumonia, whether it's a bloodstream infection, and you got to make sure your heart is okay and mentally you're okay. And once you're cleared, which might take weeks to months, you got to find ideally a living donor would be the best donor, because
Right.
those, we know a kidney from a living donor lasts much longer than a kidney from a deceased donor, which a deceased donor is when somebody who passed away and they gave you the gift of life but donating their organs.
Right, 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 right. And I hear a lot of times family members, right? Because you have two kidneys, so sometimes there are family members that donate their kidneys. That's true?
A lot of times it can be a spouse or a significant other, and a family member. And a lot of times we do go by matching of common matches the blood type. They're
Right,
not going to be a perfect match on all the other antigens that they look at, but they have a common blood type. They can be a perfect match. From a blood type standpoint, it's a family member or a significant other. But the good thing now with technology, we have what we call a paired exchange program. Let's say you have a family member that cannot donate you a kidney, but may have the same situation. Well, I'm in Memphis. They may have the same situation in Atlanta.
right.
You got a family member that can donate you a kidney, but y'all not a blood type match. They can
Okay.
put you in a paired exchange system. The person in Atlanta can donate to the person in Memphis, and my person in Memphis can donate to the person in Atlanta if they're matched. And that has happened before.
I like that. I like that. That's very unique. I haven't heard of that. That's great. That's great. Oh my goodness. Well, listen. We have really covered this topic so well, and I am just so happy. I know you got patients that you have to go see. Thank you. I want to thank you so much for carving out your time today for us to talk about chronic kidney disease. In summary, what would you like our audience to know about chronic kidney disease? So not that they don't like you, but so that they might not need to have to come to your services.
I think chronic kidney disease is one of the top 5 leading causes of death in America. It's really affecting the African American and other minority populations. It's most likely caused from diabetes and hypertension. There's other causes in the African American, especially females, things like lupus and polycystic kidney disease.
Right.
The best thing we can do is educate our patients by our primary care nurse practitioners and primary care physicians. Once we're educated, we know we have diabetes, hypertension. We know those are the top 2 leading causes of chronic kidney disease. We know, as you said earlier, we have blood pressure control less than 130 or less than the bottom for blood pressure control, and hemoglobin A1C for diabetic control less than 7. We need
Yeah. Yeah.
address
Absolutely.
obesity, address smoking cessation, and yes, activity, yes, exercising. And but the main thing is also talk to your physician, be educated, know your glomerular filtration rate, your GFR, and are you getting appropriate care? Like you said earlier, Dr. Coleman, with diabetes, are you getting eye care? Are you getting your feet checked? Is your blood pressure under control? Is your lipids under control? All this is very, very important when we look at the grand scheme of things, because patients with chronic kidney disease, not everybody with chronic kidney disease will require dialysis.
Well, listen, Dr. Wofford, we're going to close our session. I know that you're still seeing patients and you're taking care of folks out there in Memphis, but I would like you to just tell our audience just sort of some summary, thoughts you have related to chronic kidney disease.
Dr. Coleman, I'd like to thank you for the opportunity. Let me come on and talk about chronic kidney, which is very passionate, and I take to heart. and I see these patients daily. What I want to emphasize, I want an empowered, educated patient. Patient. How do we do that?
Yeah.
Uh, First, start with your primary care physician or nurse practitioner, and if you have hypertension or diabetes, try to control that. Uh, so your standard we just talked about, Dr. Coleman, your blood pressure should be less than 130 over 80.
Yep.
Over 80 for diabetes should be less than 7.
Yeah.
If we smoke, smoking cessation should be a top priority. If we're overweight, losing 5 to 10 pounds would go a long way in your overall health and improving your health. And like you said earlier, Dr. Coleman, controlling cholesterol.
Right.
We know that chronic kidney disease, that meaning that your kidneys have not been functioning normally for over 3 months. But usually by the time they see me, this has been going on for years, and your primary care has been taking care of you as much as you can. And then he sends your patient to us. Once your creatinine or GFR is less than 30, you should see a nephrologist.
Right.
You should know your glomerular filtration rate, know your GFR, and ask your primary care physician, are you getting the appropriate care? Not only for chronic kidney disease, but it starts with hypertension, starts with diabetes, eyes examined, control. If you're getting your feet examined, blood pressure under control, are you on a low sodium, low fat diet? All this goes together. We have patients live a better quality, and a better quality of life is decreasing your cardiovascular risk.
Yeah.
We do that by controlling hypertension, your cholesterol, smoking cessation, losing weight, and controlling your diabetes to a better goal, to the recognized goal.
Right, right. I agree. I agree. Thank you so much. I appreciate it, and we're going to have you back. The year is still young, so we're going to have you back. We're going to have you talk to us some more about what we need to do to live long and healthy out there, and enjoy that sunshine out there in Memphis, Tennessee. I appreciate you coming on our show today.
My pleasure. Thank you. I'll be overwhelmed if you invite me back.
All right. Take care. All right. Bye-bye.
Thank you. Bye-bye.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol and organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.